According to the World Health Organization, as of the 7th of December 2020, more than 66 million people have been infected with the COVID-19 virus. Out of those, 1.5 million sadly lost their lives, and just over 43 million have survived the virus. Unfortunately, out of those who survived the virus, a number of them have had their loved ones' lives tremendously impacted. Dr. Nomthandazo Dube was amongst those. Dr. Dube, a neurosurgeon based in South Africa, Pretoria, is a sister, a daughter, a friend, and a frontline worker. She was perfectly healthy, young, vibrant, outgoing, and social. Unfortunately, at the height of the pandemic, she contracted the COVID-19 virus. Her complications included kidney failure, lung being accidentally punctured, pulmonary embolism, empyema, and liver myotoma. And as a brain surgeon herself, she had the concern that her brain may have been impacted by the virus. Dr. Dube has kindly agreed to share her journey with us, hoping that this will help put into perspective some of the implications the virus can have on individuals and to put a face to the virus.
Good day. Welcome to Conversations with Us. My name is Mapule Masamola Ralihika, your host for today. Good day. Welcome to Conversations with Us. With us today, we are very lucky and privileged to have Dr. Nomthandazo Dube. Dr. Dube is a kick-ass neurosurgeon, if I have to say so myself, but everyone who knows her can attest to it. She's based in South Africa, and unfortunately, she has gone through the whole shebang during the height of the COVID pandemic. Hi, Dr. Dube, and welcome to our channel.
Hi, Mapule. How are you?
I'm fine, thank you. How are you?
I'm fine. Thank you for that lovely introduction.
Oh, you're welcome. Looking all beautiful and all glammed up.
Thank you. So are you.
Thank you. During the height of the whole COVID, you found yourself being in the middle of the whole saga to the detriment of everything. Can you please talk us through your COVID journey?
Okay, so basically, I worked right through the pandemic. So I think our hard lockdown started mid-March, around the 23rd of March, I think it was. And because, we had to continue. You really can't shut down the hospital,
No.
So I continued working right through. So I worked right through the hard lockdown, which was the whole of April, through May, etc. End of July, woke up, normal day going to work, woke up and I felt unusually tired. And I thought, you know what, I have been working, full speed throughout this pandemic.
Yes,
and understandably, I'm tired, but it was an unusual sort of tiredness and with like a low-grade headache, and off I went to work and I could feel that I'm also not breathing that well on that day. But I thought, I'm probably coming down with the flu. And, we were so afraid of COVID that everybody was afraid to say I might have the flu. And I thought, you can still have the flu even during COVID.
Yeah. And you're afraid to go testing as well.
Yeah, so, there's a lot of people that were afraid to go testing. But when the whole thing started, when, COVID became a pandemic and all of that, at the back of my mind, I always said that because of the job that I do, I probably will get COVID, so I always had that possibility in my head. So for me, it wasn't a fear of testing. It was just, don't panic. It could be the flu, it could be COVID. We'll find out. And off I went to work. But like I said, that day I couldn't do like normal things, like going up the stairs. When I get to the top of the stairs, I'm seriously out of breath. And I remember even thinking, gee whiz, I need to hit the gym. I'm so unfit. I can't go up the stairs, you know. Um, at the end of the day, I went to a friend of mine who's a nephrologist, and she's got a practice where I work. And I told her, you know, today I just feel so strange. Perhaps if I don't feel better tomorrow, I'll test for COVID. And she said, but why are we waiting till tomorrow? Test now,
Yeah.
then at least, and this was on a Monday. And so we called the lab. The sister came, did the nasal swab, and off I went home. But on the way home, I was super tired. You know, at some point, I remember thinking maybe I must just park my car on the side of the road and take a nap
Yeah.
because I just, I could hardly keep my eyes open. But went home and in the morning, the lab called me and they said, we're sorry to tell you that you tested positive. And I was like, oh, okay, that's fine. And immediately, I went into, okay, call my boss, tell my boss I'm COVID positive, call the people that I had come into contact with over the weekend because I'd operated that weekend.
Okay.
I'd been with family, So I was like, but I always had a mask on. In the hospital, I always had PPE on,
PPE.
but you still have to call everybody. And I call them, but in my mind it was like, okay, I need to do 1, 2, 3, order medication, make sure everything is taken care of, and I'm just going to sit in the house and isolate 10 days. I'll be fine, I'll be back at work. um, no one that I knew at the time, or very few people had been admitted to ICU or, had to be ventilated or whatever the case might be. So for me, it never even crossed my mind,
Yeah.
So I was like, oh, okay, it's fine.
You'll be
It's something I
fine.
have to do. I'll be okay. Took my supplements, medication that was recommended, etc. But my symptoms progressively got worse. The tiredness just became exponential. Then it was followed by muscle pain, extreme muscle pain.
Mm-hmm.
It was so bad that sometimes when I tried to get dressed, the clothes touching my skin would be painful. It would be
Oh
painful.
goodness. Oh wow.
Yeah, and then my shortness of breath just increased. I could hardly walk from the kitchen to the lounge or even walk outside, and without having extreme shortness of breath. I spoke to a few people before, in the days before I was admitted, and they had also remarked on, you sound like you're really out of breath, and I had a little bit of a cough.
Yeah. Okay.
Yeah, and so following that, a friend of mine who's a physician, she
Mm-hmm.
also had COVID at the same time as me, and we had been advised by another physician friend of ours that, look, you guys need to have a saturation monitor and
Yeah.
monitor your oxygen. Yeah, if your oxygen levels start dropping, then you need to go to the hospital. And on the day that I was admitted, we actually checked because I was completely out of breath. I could hardly finish a sentence on that day. And when
Yeah.
we checked my saturation levels, they were 65%.
Oh wow. That
Yeah,
low. Yeah.
which is very low.
Yeah.
And immediately, my friend drove me to the hospital, and I was admitted, and that's the last thing I remember.
Mm-hmm. It's the last
Um,
thing.
yeah, that's the last thing I remember until waking up in ICU. So that was on the 28th of July.
Okay. And how long were
And
you in ICU for?
so ICU, so I was initially, I think I was in ICU for about a month and a week, if not a month and 2 weeks,
Okay.
because I was in a coma for 2.5 weeks. And then was ventilated longer. Even so, when I woke up from the coma, the ventilation continued because obviously my lungs were still not it had not recovered. At some point, because I'd been ventilated for so long, I had to have a tube, the tracheostomy tube, put
Down the
in.
throat. Yeah.
Yeah, because of prolonged ventilation. So it took a while to get me off the ventilator. And then I had a whole lot of complications. My kidneys failed at some point. There was a time when my lung was accidentally punctured.
Oh my goodness. Oh gosh. Oh Lord. Yeah.
My kidneys failed. Then eventually they managed to get me off. Oh, then they scanned me and they realized that I also have pulmonary emboli, which are clots. And the problem, and the problem with that is now we're afraid that you might get a stroke.
Yeah.
And also from the prolonged ventilation, the worry was, is the brain okay? So eventually I was discharged from ICU. And so at the time when I was in ICU, when I woke up, I didn't realize that I couldn't walk, I couldn't wash myself, I couldn't take myself to the toilet, all those things. And I realized them probably after I'd been taken off the ventilator, and now it's like, okay, it's time to feed yourself. And I realized that it's difficult to hold the spoon,
So you lost your muscle, your muscle
Yeah,
power. You just had generalized weakness and loss of.
like, yes, yeah,
Mm.
basically. So, then I realized that it's holding a spoon is a mission, like I can hardly hold a spoon. I could feed myself, but it took time for me to get there as well. And then when the physiotherapist arrived in ICU, that's when I knew that I couldn't walk, because the first day she tried to make me sit up on the side of the bed, and I was drenched in sweat. I couldn't sit, and I realized, okay, because I'd worked with patients, that okay, I might not be able to walk here. Something is wrong, why am I not able to sit up alone? And so then the steps started. Tomorrow we're gonna sit you out in a chair. We're gonna make you stand. We're gonna And the first time I stood, I think I was in tears,
No.
because I realized I can't stand.
Mm.
And I can't stand, it means I can't walk. And
Yeah.
so by the time they put me back into bed, basically my thoughts were, am I going to be able to ever walk?
Yeah.
That was a fear now that I had, that, okay, I came here for a lung disease and now I can't walk,
Yeah. Yeah. And those are
They
the
were,
things that a lot of people don't think about when you get admitted. They just think it affects your breathing
and that's it. Yeah.
yeah.
Then I was discharged to the rehab. So I was very lucky that in the hospital that I was at, there's a rehab facility attached to the hospital. And also part of their treatment protocol is to send you to the rehabilitation center. And I went there, and, so physio continued, because obviously I started it in ICU. So, the walking bar, trying to make me stand. And what I liked about it as well is that, they would ask me, how long is a typical operation?
Yeah.
When you're operating, how long do you stand in a day? So they're
To
like, we need
incorporate
to,
what you do too. Yeah.
adapt everything. So then I started, with the walking frame, etc. But the other nice thing about the rehab center that I was at was, I had physiotherapy, I had occupational therapy, I had speech therapy, even though I could speak, and I had psychology.
Okay.
And then we had also a specialized occupational therapist, who does return to work, and
Okay.
also assist driving and all of that. And the reason I had a speech therapist was because, we've realized now that COVID affects your cognitive functions. So
Yes.
the speech therapist was there to try and assess my cognitive functions and to try and help me with that.
The speech
So
therapist or
the speech therapist,
Okay.
actually.
Oh
Yeah,
wow.
she's in that.
Okay.
So on a typical day, I would wake up in the morning and I'd start with physiotherapy. So firstly, the doctors would have a ward round to see how you're doing. Then I'd have therapy, and then from physiotherapy, I'd have occupational therapy. Then from there, I would have speech therapy, take a break, and then come back and have more physiotherapy. And then on certain days, I'd see the psychologist,
Okay.
um, which
So
was
it was a
really nice.
multidisciplinary approach to you. Yes. Okay.
Um, then I was doing quite well. I was enjoying rehab, etc. And then I developed a cough, just a little cough, and I mentioned it to obviously the treating physician, and they said, "Well, let's just do an X-ray and just see,
What's happening?
make
Yeah.
sure everything's okay." Only to find that I had an empyema, which is basically pus in one of my lungs,
Oh
and
goodness.
and I had a liver hematoma as well. So there was blood, you know.
Yeah.
So then I had to go back to ICU. So I had to go to theater to have the pus drained, the blood removed, and
And how was your mood? How did you feel when you were told that, especially when you were like this time? I assume you were progressing. You're starting to
yeah,
use a frame, and you're doing well with rehab.
yes,
Yes. So
yes.
how did it
So
feel like now you have to go back to ICU?
it was mixed emotions. I was like, okay, and I think basically it was going to be, you're going to go to theater, 24 hours you'll be back at rehab. So I was like, oh no, that's fine. And I went to and I went back to theater, and I don't remember anything from the last thing I remember is the anesthetist speaking to me, and telling me, look, this is what we're going to do, etc. And I wasn't concerned at all. And when I woke up, it was 5 days later
Oh
instead of
gosh.
24 hours.
Instead of 24
So,
hours, yeah.
and I was on a ventilator again. I was
So you had to
ventilated
start. Did you fear that you have to start from learning to walk again, or because of your medical knowledge,
yes,
you knew that you were
yes.
not
So,
going back to
yeah,
that level? Yeah.
yeah. Yeah, exactly. Because now I'm ventilated again and I'm back in IC, and I'm thinking I had made so much progress.
Yeah.
And also I don't know what's happening. Why am I getting all these complications? And eventually I was weaned off the ventilator again and sent back to rehab. And the nice thing is when I got back to rehab, I actually hadn't lost a lot of ground.
Oh,
So I could sort of, I was able to pick up from where I'd left off, and continue with the rehab. And what I also liked is that my therapist, asked me, what are your goals? What do you want to get out of this? I want to walk out of the hospital. I want to be able to operate again. I want to be able to go back to work, etc. Yeah.
okay. Okay. So that brings me to, I suppose that's when you were introduced. I know you said you were introduced to OT before then. So, as an occupational therapist myself, I want to look at what were your goals, your occupational therapy goals? What was the focus?
Okay, so from occupational therapy was, so the physiotherapist had explained to me that the occupational therapist will probably work more on my coordination and fine motor movements and all of that. Obviously to prepare me to go back to work and to prepare me to be able to live at home, to take care of myself and all of that. So in that way, yeah, so I knew that we'll be working on intrinsic muscles, fine motor movement, and all those things.
Okay. And how was the
I don't know if that answers.
yeah, it's answered me. How was that carried on? What did they involve when they picked activities that we worked on those, like the fine motor activities, the intrinsic muscles, and
Yeah.
so forth? How was that? What sort of activities were involved? Let's say.
Okay, it was interesting. Yeah, at first I was like, okay, I'm not sure what we're trying to do here. You know, like, okay, I know this. It just, at first you're thinking, okay, really?
I
I
don't want
feel
to
like
do
I'm five. You know? Yeah, like, like I have to put a thing, like a little, for example, we had a board where you had this round, you had like, I don't know what, like almost like a cork
Mm-hmm.
that you had to put in a hole, and you're like, okay, really, I can do this with my eyes closed until you actually start to do it. And then you're like,
Yeah.
oh, okay, actually, I can't, little things like that. I mean, we did a lot. We did, some of the things we had the Play-Doh.
Mm-hmm.
They made me work a lot with the Play-Doh for my hands.
Mm-hmm.
Sometimes they would put marbles in the Play-Doh, and I had to try and remove the muscles, sorry, the marbles,
The
like
marbles there.
from the Play-Doh with one hand. Yeah, and obviously, mold the dough and all of that. They took me to the kitchen, and I don't cook. I don't know how to cook.
No. I know I was
Made
very
me make
shocked
a
to hear
salad.
that, but yeah.
So one Friday they made me join the cooking team that was making fruit salad, and they were like, "You need to learn how to hold a knife and be able to cut." So cut a whole lot of fruit and made a fruit salad, and I was very very proud of myself. And yes, thank you.
Well done.
Made biscuits. Explained to me that you're going to knead the dough, and that's going to help to strengthen the muscles in your hands. That
Mm-hmm.
you're not going to use some fancy machine. I need you to work your hand. So a lot of the times they would explain that you're doing this because of this.
Mm-hmm.
There was beading. We did a lot of beading, and the beads got progressively smaller.
Mm-hmm.
And
More
progressively
challenging.
more frustrating. Yes, but it was really I quite enjoyed it, and I think I did tell you once that it was meditative, a little bit meditative as well. And one of the other things that they did, which I appreciated, they managed to get suture material, a needle holder, and a scissors so that I could practice suturing. And then they got me a sponge, and I
Mm-hmm.
sat and I sutured a sponge so that we could see if I'd be able to suture. So I had to suture letters.
Yeah.
So some of the other things I did tapestry, which was
Mm-hmm.
so frustrating.
Was it frustrating?
So frustrating to do tapestry work because it's so intricate. But that you have to concentrate. So you could see. So I could sort of understand why certain things were being
But,
done. Yeah.
so, do you think they focus more on activities which are related to your work? Like as occupational therapists, we look at a holistic view of a person.
Mhm.
So we would choose activities that will describe what we call the occupational performance area. So that's work or play if it's a child, leisure or social for an adult, personal
Mhm.
management, and sleep. Do you
Mhm.
think that the activities that were chosen while focusing on one area, one aspect of your occupational performance areas of those areas, or do you feel like they use a combination of focusing on the combination of the areas?
I think it was a combination, especially if you bring in not only OT, but if you bring in, because they were very in sync with each other. If you bring in the physio, the OT, and and everybody else, they were very in sync. But like I said, I found at first I was skeptical,
Mm-hmm.
but once everybody started explaining, and they were very good at explaining. If you ask, okay, what is this?
Why am I doing this here?
Why am I doing this? They would explain it to you, and that's what I liked. So sometimes it was, they would say, we're going to work on your hands today. We want to build your fine motor skills.
Mm-hmm.
Um, you know and maybe they won't tell me, but I realized that it also includes the concentration, which is
Mm.
cognitive, you
Yes.
know. And then
Do you think it includes the endurance because you're doing it in a certain position for a
yes,
certain period of time as well? Yeah.
yes, because remember, when I sat on the side of the bed, that's when I realized that my core muscles were weak, you
Yes.
know, and
Yeah.
all of those things. So when we were in rehab initially, you would come with the wheelchair,
Mm-hmm.
and I don't know if anybody sat in the wheelchair, but it's not the most comfortable thing
No.
in the.
No. No.
After a while, you're just like, I'm okay. Can I just get off here and get back
Yeah, and
onto the
just lie
bed? But
down. Yeah.
yeah, yeah. So yes, it also there was also the endurance, being able to sit up um for a certain amount of time. There was concentration, all those things, all the cognitive stuff that they did. So it was a nice combination. I felt like it was a nice combination. And
Combination. Yeah.
yes, because the other thing they would also ask, what type of house do you live in?
Yeah.
Do you have stairs? Do you how are your tiles? They
Okay.
went as far as that. Do you have those slippery tiles? How is your shower? Do you shower or do you bath? Things like that. And also, obviously, at work, how far do you park? What do you
Yeah.
do? How much time do you stand? How much time do you sit? And all of that. So it was really quite nice.
No, that's really good. It's quite good that you have that kind of you have a positive experience. Is there anything would you say you would think they would have done better?
They would have done better.
Especially in rehab, do you think maybe if they had explained, because you're at a high level of functioning, being
Yeah,
a neurosurgeon, being independent, because you're very independent, very active, doing all
yeah.
crazy stuff like jumping down bridges and stuff. So do you think, yeah, do you think if they had explained certain aspects or why they did certain things a certain way, would have made you more want to do them longer?
Look, I think you can never explain enough to anyone. And I probably had the advantage that everybody knew that I was a doctor and everybody knew that I was a neurosurgeon. So even if they overlooked the explanation, I would ask, like, look,
Yeah.
why are we doing this? But also, I think initially when we started, some of the activities that I did, I got bored very quickly,
Mm-hmm.
because I was like, I would do it in a few minutes and I'm
Then
just
you're
sitting
done.
and twiddling my
Yeah.
thumbs and I'm like,
Yeah.
okay,
You need
really?
to. Yeah.
So I think the nice thing though is that then they recognize that and then I would have a lot more activities than probably the other patients,
Mm.
because of the fact that I got bored so quickly.
So easily. Yeah.
Um, yeah, so easily. And um, what I also liked is the creativity.
Mm-hmm.
Because tapestry, really, I never thought of tapestry.
No,
I've
as a
seen it on
treatment.
TV, but I never thought I'd be doing it
Yeah.
actually.
Yep. Yeah.
And little things like we made earrings, we made
Yeah.
a bracelet which I must still go and fetch.
Okay. Yeah. Now we'll be
But
waiting for we'll be placing our orders soon for those bracelets. Yeah.
yeah, but explain, I think nothing beats talking to patients a
Yeah.
lot. And
Yeah.
I suppose the other thing that I would change with the rehab is they had a lot of patients.
Yes.
They had quite a few patients, so they have a huge volume of patients. So you don't always get
The one-to-one.
individual attention. Yes,
Yeah.
it's impossible to get the one-to-one. So that's probably one of the things that I would change is
Mm-hmm.
more, because if you've got five patients and one patient is slower than the rest,
Yeah.
then everybody else sort of like, okay, finish already so we can move
To the
on
next one.
type thing.
Yeah. Yeah.
Yeah, yeah.
Yeah. Oh, that's good. That means there's a demand out there for therapists in a way. So
Oh,
any therapist in
absolutely.
South Africa, now you know where to go. Yeah. Because it's
No,
very
absolutely.
Yeah, I was just saying there's very few therapists, especially from the occupational therapy side, who are in the clinical world, and the
Mm.
need or the demand is there. There's so much more that they can do. Yeah.
No, it's definitely there, and I think a lot of people don't realize that like I said in the beginning, we COVID is has always just been a respiratory disease, you
Yes.
know.
Yes.
So with me, when I kept saying I'm in rehab, a lot of people would say to me, "What are you doing in rehab?
Yeah.
Why would you be in rehab?" And we don't realize that sometimes it does affect everything else,
It
you
affects all
know.
that, and it's just it makes sense. I mean, after spending such a long time in ICU with limited movements, you,
Yeah,
your muscle wastage or
yeah.
weakness, it's bound to be one of the side effects. And we were talking earlier about some of the side effects of COVID that we've heard from other people. I was saying that we know of someone who's went blind from having COVID because of the optic
Yeah,
nerve being affected. And you were telling me about some other people who've had long-term
yeah,
complications.
yeah. I
Yeah.
mean, I have a relative who's on dialysis for life.
Hmm.
I mean, I was lucky. My kidneys failed. I had dialysis while I was in ICU, but luckily, I didn't have to be on dialysis for life.
Long-term, yeah. Yeah.
But it can affect everything.
Everything, yeah. I mean, those ones who've gone off without having to have any, who've had mild symptoms or what we call mild symptoms, they're a bit lucky. And you're also telling me about other people who've had to have their legs amputated as a result
Yes.
and
Yeah.
so forth. And I
Yeah.
know from
Yeah.
my end, yeah, I know from my end this side working in rehab, we've had to send people home in with hospital bed with oxygen. We don't know, and hoping that our community therapists will be able to go there and progress their mobility, because keeping them in hospital while we trying to create space for other patients, it's not very practical. Once you deemed medically stable, we need to get you out. I guess that's the practice is
Yeah.
different, obviously, from country to country. But
To country, that's true. But
yeah.
also from patient to patient, I'm lucky that I'm in the medical fraternity,
Mhm.
and because I'm in the medical fraternity, I socialize, or I also studied with people from also, all parts
There's
of
a
the
background.
medical field,
Yes.
Yeah, so once I was discharged from rehab, I had people that gave me one-to-one therapy,
Yes.
that
Yeah.
called me and said, look, I know you've had rehab, but come in, we'll reassess, see where we can help. So
Mhm.
I also got like extra help, like extra therapy from people that were just like, we want to make sure that you're
You're
okay.
okay.
We've
Yeah.
did this. We want to make sure that there's no gap between you getting therapy at the hospital and you getting outpatient therapy.
Therapy. Yes.
Yes, because the as much as I could walk out of hospital, I wasn't walking like I'd
At
walked
that
before.
level. Yeah. At the
Yes,
level you were before. Yeah.
you could see that okay, something is wrong here,
Mm-hmm. Mm-hmm.
and so continuing with outpatient therapy really helped.
I can.
With things like that. Yeah.
Yeah. No, I can imagine that. What are your thoughts about those people who think that no, we just need to live with the virus? We just have to learn to live with the virus. It's gonna be here for long. A lot of people think I'm very OCD and OTT about, the whole COVID, but I think it's because I've seen what's been happening out there. And yeah, so what are your thoughts about that?
I'm very frustrated and I'm very anxious at the moment.
Mm-hmm.
I have anxiety about going out, and I'm also I it worries me that people think that it's not real, and that you you know, I'm just gonna get some mild symptoms and I'll be okay and all
Or
of
I'm
that.
young.
I had no premorbidities.
Mm,
I'm not 65.
mhm.
I was not on any chronic medication. I had no comorbidities. I was relatively healthy, before everything happened, and yet I had the worst complications. At some point, everybody was scratching their heads, trying to figure out why would a young, active, young woman with no comorbidities be so sick, have all the complications that usually occur to people with comorbidities.
Yeah.
So people are too, we're too relaxed. You think, oh, it's not gonna, I'm healthy.
Yeah.
No, it can happen to you as young and healthy. And I know quite a few of my colleagues that are young, healthy, healthier than me, even healthier, younger, stronger, faster, that have ended up in ICU
And a
because
lot
of
have
COVID.
lost their life as well. A lot of people, like, yeah, they've lost their lives due to this, which is not, yeah, yeah, which is not fun. And
Yeah.
and another thing that which I also find quite difficult, like currently in the UK, I'm UK based anyway. Currently in the UK, we have just come out of a lockdown, and there were images this morning of our shopping centers, which are very, very full at the moment. And then this is with the aim that during the Christmas period, they're giving us 5 days break from COVID. Apparently, COVID is going to take a break for 5 days. I'm only joking. So that we can all mix with more than one household, like three households mixing together. I mean, I personally think, like, I mean, come on, with the vaccine being here, tomorrow they start vaccinating people in the UK. I know vaccine cannot guarantee everyone, but don't you think that's a bit premature to give those orders for three different family or three different households to come together after the period?
I think our governments are between a rock and a hard place
Mm-hmm.
a lot of the time, and it would be nice if people would be kept at, if stay home, don't go anywhere. But the reality is, at some point, everybody gets fatigue, and I think there's a lot of people with COVID fatigue at the
Yeah.
moment. Um, but at the same time, we can't just forget that we have a pandemic,
No.
and everybody still needs to take the precautions. The government can only do so much.
Mm.
All of the governments in the whole world, they can only do so much, but mostly it's us. We're the
Mm.
ones that need to make the changes. We're the
Mm.
ones that, need to think.
Mm.
So maybe it was premature, maybe not, but I think they're between a rock and a hard
That
place.
place. And do you
And
think also
at
it's
some
because, yeah, do you think that because everyone's got the information now how to prevent, they letting us make the decisions ourselves?
yourself, yes, I probably, it's probably it. Yeah, and like I said, COVID fatigue is a thing. There's a lot of people
Mm.
that are just like, okay, I've had it.
I'm
I
tired,
can't stay at
yeah.
home anymore. I have
Yep.
cabin fever and all.
Mm.
So yeah, they can. I sympathize. I used to always say I really sympathize with what our president, for example, has to go through, because he has to
Damned if he does, he's damned if
play
he doesn't, yeah.
exactly,
Yeah.
exactly. So that's where it is. And yeah, I think also we're just so excited about the vaccine that a lot of people are like, oh, the vaccine is coming, so I don't have to do
Yeah.
anything. I'll be fine and all of
Mm.
that. But yeah, we'll see.
It takes a month. If even if it does work, it takes at least a month to be to be
So you
active.
see, so
Yeah.
you see,
Yeah.
it's so and that type of information. How many people do they have?
Yeah.
How many people have that type of information
Information.
as
Yeah.
well?
Yeah. Well, thank you so much, Dr. Dube,
No,
for
it's a pleasure.
participating. I mean, I hope this can be informative to a lot of people, can allow people to make sound decisions and be aware of the decision they make, the implication of the decisions they make on not just their families and the loved one, but on the health system. Because at the moment, there's some areas where the health system is not able to tolerate or the amount of admissions. There's some stages where a lot of other serious conditions are put on hold because they have to attend to the pandemic first. Yeah, and even those ones who've had mild symptoms, who had a chance of surviving because of not, COVID fatigue does also affect health workers, but because of the health workers being tired as well, they might not get the best care that a lot of people may have, Yeah, so thank you, and I really, really hope this is very informative. Thank you.
And also, sometimes you need to see the face of what you're talking about.
Face
And yeah, because it's easy to see people on TV and you're like, oh, okay, no, somebody on TV. But when somebody tells you their story, I think hopefully it'll help.
Well, it has helped me because it has kept me sane. So the minute I heard, I was like, I am staying put. I'm not doing anything silly. But thank you again. It has definitely helped.
Yeah.